Everybody. Welcome to the February Wellness Webinar. My name is Laura Maloof Miller. I'm a Senior Health Education Specialist with HealthNet. A special welcome to those who may be joining us for the very first time. Kristen Kayla, Health Promotion Consultant with HealthNet, is also on the line with me. And just a few housekeeping items to review before we begin. Everyone has been muted upon entry to the webinar. That helps us avoid any background noise. And if you want to change your audio settings, you simply click on the join audio icon. Also, at the end of the webinar, there will be a quick 4-question anonymous survey. Whoops. All right. Now, if you're having any technical difficulties, feel free to chat directly to Kristen. And all you need to do is open the chat box, hover over the Zoom toolbar at the top of the screen. You will see a chat box icon there. Simply click on the icon and it should appear. Now, Kristen will receive your messages in real time, and she'll respond to your message in the order that she receives them. So if there's any delay in her response, she'll get to your message as soon as she can. Also, if you've attended this webinar in a conference room or used a single webinar access with your team, please chat that number of attendees to Kristen so that we can get a more accurate number on attendance. Today's topic, heart health by the numbers. Please keep in mind the information provided in this presentation is intended solely for the general information of the audience. It's not medical advice and shall not replace consultation with your physician or other qualified health provider. If you have any health-related questions or problems, please seek the advice of your physician or other qualified health provider. This is what I'm going to cover in the webinar today. The ways to stay heart healthy all year long, not just for February when it's Heart Health Month. Heart disease risk factors, the major ones, modifiable ones, and the contributing risk factors. The complications of heart disease. Now, this is going to include things like angina, high blood pressure, stroke, and others. And when it comes to heart health, there are a few numbers you should know, and how to keep your ticker in tip-top shape. So these are the things that you can do to prevent heart disease. And it's not all bad news. The silver lining is that many of the factors associated with high risk for heart disease can be reduced or eliminated with the adoption of healthy lifestyle habits. Let's take a look at some risk factors for heart disease. There are 3 different types of risk factors: major, modifiable, and those that contribute to heart disease. Now, you may be born with certain risk factors that you cannot change. The more major risk factors you have, the greater your chance of developing coronary heart disease. Now, that is going to include your age. Most people who die of coronary heart disease are 65 or older. Male gender. Men have a greater risk of heart attack than women do, and men have heart attacks earlier in life. Now, even after women reach the age of menopause, when women's death rate from heart disease increases, women's risk for heart attack is less than for men. However, do not get me wrong, heart disease is still the #1 killer of women. Heredity. Children of parents with heart disease are more likely to develop heart disease themselves. African Americans have more severe high blood pressure than Caucasians and a higher risk of heart disease. Heart disease risk is also higher among Mexican Americans, American Indians, Native Hawaiians, and some Asian Americans. This is partly due to higher rates of obesity and diabetes. Modifiable risk factors include things like high blood pressure, smoking, cholesterol levels, weight, diabetes, and prediabetes. And these are considered modifiable because they can be changed, treated, or controlled with medication and/or lifestyle changes. Contributing risk factors. Now, that includes things like a diet that's high in saturated fat, trans fat, and cholesterol, not getting enough physical activity, drinking too much alcohol, tobacco use, lack of sleep, and high stress. Now, this is a list of risk factors that you can modify, treat, or control. And I'm going to review each of these risk factors in the upcoming slides. the risk that smokers will develop coronary heart disease is much higher than non-smokers. As for blood cholesterol, as it rises, so does your risk of coronary heart disease. And when other risk factors such as high blood pressure or tobacco use, if they're also present, of course, that increases your risk even more. An inactive lifestyle is also a risk factor. Physical activity can help control blood cholesterol, diabetes, and obesity. Actually, in some people, it can also help to lower the blood pressure as well. Now, people who have excess body fat, especially if a lot of it is around the waist, they are more likely to develop heart disease and stroke, even if the same people have no other risk factors. Now, diabetes seriously increases your risk of developing cardiovascular disease, especially if it's uncontrolled. Now, stress is not necessarily a bad thing. However, the lifestyle behaviors that are often associated with high stress can pose a risk, such as unhealthy diet, lack of exercise, smoking and drinking, and high blood pressure. This increases the heart's workload, and it also increases your risk of stroke, heart attack, kidney failure, and congestive heart failure. Let's do a quick poll. Almost 1/3 of the deaths from coronary heart disease are due to smoking and secondhand smoke. Let me go ahead and launch this. And is that true or false? Give you a couple seconds as folks take the poll here. I should have the Jeopardy theme song going in the back, but almost 1/3 of the deaths from coronary heart disease are due to smoking and secondhand smoke. What do you think about that? Couple more seconds to get a few more responses. I see it slowing down a bit, and this is optional. You don't have to vote if you don't want to. All right, I'm going to go ahead and end the poll. We have a bunch of smarty pantses on the line, Kristen. Yes, this is absolutely true. All right. You probably know about the relationship between smoking and lung cancer. But did you know smoking is also linked to heart disease, stroke, and other chronic diseases? Smoking can increase your risk of cancer of the bladder, throat, mouth, kidneys, cervix, and pancreas. And smokers aren't the only ones affected by tobacco smoke. Secondhand smoke and vapor is a serious health hazard for non-smokers, especially children. Now, non-smokers who also have high blood pressure or high blood cholesterol, they have an even greater risk of developing heart disease when they're exposed to secondhand smoke. Vaping is the act of inhaling and exhaling the aerosol, often referred to as vapor, which is produced by an e-cigarette or a similar device. Now, vapor consists of fine particles containing varying amounts of toxic chemicals, and those have been linked to heart and respiratory diseases and cancer. So take a look at the statistics on this slide. It's the most preventative cause of death in the United States, linked to 90% of the lung cancers. Smoking rates overall are down, but really the ages between 21 and 34, still quite a bit smoking. And vaping is another serious health risk. It's super attractive to our youth because of those variety of flavors that are available. And as a side note, being a current or a former smoker can make you more likely to get severely ill from COVID-19. Smoking causes the inflammation and cell damage throughout the body, and it can weaken the immune system, making it less able to fight off disease. If you smoke, you're likely aware that you're not doing your body any favors. And even if you want to, it's really, really hard to give up. That's how addictive it is. Nicotine alters the balance of chemicals in your brain so that each time you inhale it, it makes you feel relaxed, less stress, and wanting more. So what happens when you try to cut back? It makes you feel bad, hitting you hard with headaches. You may feel lethargic, lightheaded, and downright lousy. So what does smoking do to your body that puts you at risk for heart disease? Well, it may surprise you to learn that smoking increases the risk of heart disease and stroke by 2 to 4 times. Also, women who smoke have a 25% higher risk of developing heart disease as compared to men who smoke. Continuing to smoke throughout your life shaves 13 to 14 years off of it. Nicotine makes your heart rate and your blood pressure skyrocket. Carbon monoxide and tobacco rob your heart, brain, and arteries of oxygen. It damages your blood vessels and makes your blood sticky. That's going to be a recipe for blood clots. It lowers your tolerance for physical activity and decreases your HDL, which is the good cholesterol. And if you take oral contraceptives, it increases your blood pressure and risk for stroke and heart attack. Another quick poll before I start talking about cholesterol. You're out to dinner, bread's on the table. There's also butter and olive oil. Sometimes olive oil comes with the balsamic vinegar as well. Which one or neither is going to be the heart healthy choice? Let me go ahead and launch the poll. Here it comes. All right, is it butter, olive oil, or neither? Which is going to be the heart healthy choice? All right, couple more seconds. All right, great job. Okay, you know, these aren't supposed to be hard, but anyway, I'm going to share the results. You guys got it. That's going to be the olive oil. Okay, so you got to remember that both butter and olive oil, those are fats, and they have the same number of calories. But the heart healthier choice is going to be the olive oil. And that is because it's liquid at room temperature and is a monounsaturated fat. So we want to try and limit fats that are solid at room temperature, things like butter, Crisco, lard. You don't want to put too much of that in your body, okay? All right. So high cholesterol. Cholesterol is a waxy substance, okay? It's not inherently bad. In fact, your body needs it to build cells, but too much cholesterol can pose a problem. So where's it going to come from? 2 sources. Your liver makes all the cholesterol you need. The remainder of the cholesterol in your body, now that's going to come from foods derived from animals, such as meat, poultry, full fat dairy products. Those all contain cholesterol. Now, some tropical oils, such as palm oil, palm kernel oil, and coconut oil, they can also trigger your liver to make more cholesterol. These oils are often found in baked goods, the things we like to eat. There are 2 different types of cholesterol. So LDL cholesterol, that's the bad, and HDL, that's the good. So too much of the bad kind and not enough of the good kind increases your risk that cholesterol will slowly build up on the inner walls of the arteries that feed the heart and the brain. So cholesterol can join with other substances to form a thick, hard deposit on the inside of the arteries. That can narrow the arteries and make them less flexible. Now, if a blood clot forms and it blocks one of these narrowed arteries, we're talking heart attack or stroke can result. Now, your total cholesterol score is calculated by using the following equation. Your HDL value plus your LDL value plus 20% of your triglyceride level. So what are triglycerides? Those are the most common fat in the body. Most of our body fat is stored as triglycerides. Now, a lipid profile or a lipid panel is a blood test that's going to give you results for the good cholesterol, the bad cholesterol, your triglycerides, and also your total blood cholesterol. The test results will show your cholesterol in levels in milligrams per deciliter of blood. Now, the total cholesterol and the good cholesterol, those values are among numerous factors that your doctor can use to predict your lifetime or 10-year risk for a heart attack or a stroke. So your doctor will, of course, also take other risk factors into account, such as your age, your family history, smoking, and high blood pressure, and can recommend treatment approaches accordingly. And I'm going to be covering what the normal ranges for these numbers are in just a few minutes. We know that a sedentary lifestyle can put you at risk for heart disease. This activity pyramid outlines the activities we should be doing every day, most days of the week, 2 to 3 times a week, and the types of sedentary activities we should limit. The physical activity guidelines for Americans recommends adults do at least 30 minutes of exercise most days of the week. So it's moderate intensity activity, such as brisk walking. In addition, adults need to do activities that also strengthen your muscles at least 2 days a week. Prolonged sitting, like we do while we're working in front of a computer, that is now just as bad for our health as smoking. We need to get up and move. Setting a timer on your watch or your cell phone, or using an app that reminds you to get up is a good idea. Moving helps to prevent blood clots, which can form with prolonged sitting. Obesity is a complex health issue resulting from a combination of causes and individual factors, such as behavior and genetics. Behaviors can include things like physical activity, inactivity, dietary patterns, medication use, and other exposures. Additional contributing factors could include food, the physical environment, education and skills, and food marketing and promotion. Now, obesity is associated with poor mental health outcomes and reduced quality of life. Healthy behaviors include regular physical activity and healthy eating, trying to balance the number of calories consumed from foods and beverages with the number of calories the body uses for activity. This plays a role in preventing excess weight gain. A healthy diet pattern follows the dietary guidelines for Americans, which emphasizes eating whole grains, fruits, vegetables, lean protein, low-fat and fat-free dairy products, and drinking water. Now, people and families, they make decisions based on their environment or community. For example, a person may not walk or bike to the store or to work because of the lack of sidewalks or safe bike trails. What about family history? Now, healthcare practitioners routinely collect family health history to help identify people at high risk for obesity-related diseases, such as diabetes, cardiovascular diseases, and some forms of cancer. Now, families can't change their genes, but they can encourage healthy eating habits and physical activity. Those changes can improve the health of family members and improve the health history of the next generation. Other factors include diseases and drugs. Now, some illnesses may lead to obesity or weight gain. These may include Cushing's disease, polycystic ovary syndrome, and thyroid conditions. Drugs such as steroids and some antidepressants actually may cause weight gain as well. A healthcare provider can help you learn more about your health habits and history to identify whether behaviors, illnesses, medications, and/or psychological factors are contributing to weight gain or making weight loss hard. If you've been diagnosed with pre-diabetes or diabetes, making diet, exercise, and lifestyle changes can make dramatic improvements to reduce your risk of heart disease. People with diabetes are 2 times more likely to die from cardiovascular disease, such as heart attacks and strokes. And the longer you live with diabetes, the higher your cardiovascular disease risk. Now, people with type 2 diabetes often have other risk factors, such as high blood pressure, high cholesterol, excess weight, and lack of physical activity. We know that diabetes can damage blood vessels and nerves that control your heart and blood vessels. And even with well-managed diabetes, it still increases your risk of a heart attack or stroke. When it comes to high blood pressure, we know that high blood pressure increases the heart's workload, causing the heart muscle to thicken and become stiffer. It also increases your risk of stroke, heart attack, kidney failure, and congestive heart failure. When high blood pressure is present alongside obesity, smoking, high blood cholesterol levels, or diabetes, the risk of heart attack and stroke increases even more. And you know, it's the silent killer because it has no symptoms. That's why it's so important to get it checked. Now, common hereditary and physical risk factors for high blood pressure are listed on the left side. If your parents or other close blood relatives have high blood pressure, there's unfortunately an increased chance that you're going to get it too. If the older you are, the more likely you are to get high blood pressure. As we age, our blood vessels gradually lose some of their elastic quality, which can contribute to increased blood pressure. African Americans tend to develop high blood pressure more often than people of any other racial backgrounds in the United States. It also tends to be more severe in African Americans, and some medications are less effective in treating high blood pressure in this population. Now, the modifiable risk factors are on the right side. These are risk factors you can change to help prevent or manage high blood pressure. Not getting enough physical activity as part of your lifestyle increases your risk of getting high blood pressure. A diet that's too high in salt, calories, saturated in trans fat, and sugar carries an additional risk for high blood pressure. So does carrying too much weight. It puts an extra strain on your heart and the circulatory system. Now, regular, heavy use of alcohol can cause many health problems, including heart failure, stroke, and an irregular heartbeat or arrhythmia. It can cause your blood pressure to increase dramatically and can also increase your risk of cancer, obesity, alcoholism, suicide, and accidents. Obstructive sleep apnea may also increase the risk of developing high blood pressure. And more than half of the people with high blood pressure also have high cholesterol. And most people with diabetes, they also tend to develop high blood pressure. Now, using tobacco can cause your blood pressure to temporarily increase and can contribute to damaged arteries. Stress. Now, that's not necessarily a bad thing, but too much stress may contribute to increased blood pressure. There are some other risk factors that contribute to the development of heart disease. This includes stress, alcohol, and sleep. Let's take a closer look. Some scientists have noted a relationship between coronary heart disease risk and stress in a person's life, along with their health behaviors and socioeconomic status. These factors may affect already established risk factors. Now, your mind deserves better than to be loaded down with never-ending job of worrying. Some stress can actually be beneficial and may lead to actual problem solving. But a lot of our stress is unnecessary and even harmful. We all have stress at work, at home, on the road. Negative stress can keep you from feeling and performing at your best, mentally, physically, and emotionally. But no one's life is completely stress-free, so it's important to know how to manage stress in your life. More research is needed to determine how stress contributes to heart disease. But stress may affect behaviors and factors that increase heart disease risk, such as high blood pressure, cholesterol levels, smoking, physical inactivity, and overeating. And your body's response to stress, it may be a headache, back strain, or even stomach pains. Stress can also zap your energy, wreak havoc on your sleep, and make you feel cranky, forgetful, and out of control. A stressful situation sets off a chain of events. Your body releases adrenaline, a hormone that temporarily causes your breathing and heart rate to speed up and your blood pressure to rise. Now, these reactions prepare you to deal with a situation. That's the fight or flight response. However, when stress is constant, your body remains in high gear, off and on, for days or weeks at a time. We've all seen the headlines about studies associating light or moderate drinking with health benefits and reduced mortality. Some researchers have suggested that there are health benefits from wine, especially red wine, and that a glass a day can be good for your heart. Wait a minute, there's more to the story. No research has actually proved a cause and effect link between drinking alcohol and better heart health. Now, the components in red wine, such as flavonoids and other antioxidants, they can potentially reduce heart disease risk. But they can also be found in other foods like grapes, red grape juice, and blueberries. Now, the best known positive health effect of alcohol is a small increase in HDL, or the good cholesterol. But regular physical activity is even more effective way to raise your HDL cholesterol. Here's what science tells us about alcohol's effect on the body. Drinking too much alcohol can raise your triglycerides. That's a high triglyceride level combined with high levels of bad cholesterol or low levels of the good cholesterol. That's been associated with the fatty buildup in the artery walls. Excessive drinking can also lead to high blood pressure, cardiomyopathy, that's a chronic disease of the heart muscle, cardiac arrhythmia, that's the irregularity in the heartbeat, and even death from alcohol poisoning. And it can interfere with the brain's communication pathways, affecting the way the brain works. Now, heavy drinking is also associated with premature aging of the arteries, particularly in men, when compared to moderate drinkers. Plus, all the extra calories from drinking alcohol, that can lead to obesity and higher risk of developing diabetes. What's the bottom line? Drink alcohol beverages only in moderation, if at all. Understand the potential effects of your health if you do indulge, and don't start drinking for unproven health benefits. What about sleep? How does sleep affect our heart health? Now, studies show short sleep duration or poor sleep quality is associated with high blood pressure, elevated cholesterol, and atherosclerosis. That's when the fatty material builds up on the inside of the artery walls. And habitual short sleep increases the chance of cardiovascular events. Now, a study of 495 participants found an association between poor sleep quality, increased food intake, lower consumption of whole grains, and short sleep duration, which may lead to weight gain, even in those with a low risk for obesity. This is especially true for children and adolescents who need more sleep than adults. So not getting enough sleep may affect a part of the brain that controls hunger. So sleepy people are hungrier. Guess what they crave? High fat, high sugar foods. Now, doctors and scientists have known for decades that insufficient sleep affects the body's hormone levels and ability to regulate and metabolize glucose. That means if you're excessively sleepy, you could be at higher risk for weight gain and type 2 diabetes. Now, why would lack of sleep affect hormones and glucose metabolism? Well, part of the answer may lie in the slow wave sleep. When a person enters slow wave or the deep sleep, nervous system activity goes down. The brain uses less glucose, and other changes occur, such as an increase in growth hormone and a decrease in the activating hormone cortisol. For this reason, a sufficient amount of deep sleep is thought to be very important to the regulation of glucose in the body. A growing body of research also demonstrates a correlation between many sleep disorders and cardiovascular health. People with common sleeping disorders, such as obstructive sleep apnea or insomnia, also are far more likely to have heart arrhythmias, plaque buildup, heart failure, and coronary artery disease than the general public. When we talk about insomnia, we're referring to trouble falling asleep, staying asleep, or both. As many as 1 in 2 adults experience short-term insomnia at some point, and 1 in 10 may have long-lasting insomnia. Now, heart disease is an umbrella term, meaning it describes many conditions that affect a person's heart health. This includes the heart muscle, heart valves, coronary arteries, or heart rhythm. Each of these components plays an important part in a person's overall heart health. This is not a complete list of conditions that can affect the heart. These are just some of the major ones. Angina, that is the medical term for chest pain. This occurs when the heart muscle doesn't get enough oxygen. The result is a feeling of squeezing or pressure in the chest. And the most common types are called stable and unstable angina. Now, stable angina is known as angina with physical exertion. I remember my dad, he was in his 80s and he would have chest discomfort when he was mowing the lawn. Because exercise and exertion increase the body's requirements for oxygen, the heart muscle can suffer. Now, unstable angina, this is more concerning symptom because it's chest pain that occurs unrelated to exertion. A heart attack occurs when the coronary arteries narrow so much that they cut off blood supply to the heart. Often this is a result of cholesterol buildup in the arteries. A piece of that cholesterol can break off and it can block the blood vessel. The heart cells begin to die as they're deprived of oxygen. Symptoms include shortness of breath, severe chest pain that may radiate to the back, jaw, or the left arm. Now, a stroke is when the heart isn't working effectively. Blood clots are more likely to form in the blood vessels. A stroke occurs when one of these clots lodges in a blood vessel in the brain and cuts off blood flow. Stroke symptoms include numbness on one side of the body, confusion, trouble speaking, loss of balance or coordination. Heart failure occurs when the heart cannot adequately pump blood throughout the body. The heart muscle is very strong. However, over time, the muscle can be affected. The heart starts to compensate by beating faster, building up more muscle or stretching to accommodate more blood. Over time, these methods of compensation can affect the heart's function and result in heart failure. This can cause a shortness of breath, dizziness, confusion, and the buildup of fluid in the body, causing swelling. High blood pressure. You know, this is also called hypertension. It means the pressure in your arteries is consistently above the normal range. Blood pressure is the force of the blood pushing against the blood vessel walls. A normal blood pressure reading is less than 120/80. And we don't know exactly what causes it, yet high blood pressure can lead to hardened arteries, stroke, or heart attack. Now, women and men can have different symptoms related to their heart disease because they are more likely to have different parts of the heart affected. For example, women most commonly develop heart disease in the smaller arteries that branch off the heart's major or coronary arteries. As a result, women may experience nausea, shortness of breath, vomiting, or stomach pain. Men are more likely to experience heart disease that affects or blocks the major coronary arteries. So this can cause the symptoms that most people are commonly associate with heart disease, such as the crushing chest pain, tightness, or pressure in the chest, particularly with stress or physical activity. Now let's take a look at those important numbers you should know for your heart health. Your healthy target for total blood cholesterol should be less than 200 milligrams per deciliter. The bad cholesterol should be less than 100. The HDL, the good cholesterol, greater than 60. And your triglyceride, that should be under 150 milligrams per deciliter. Now, your body mass index is a weight and height calculation that can help determine if you're overweight. It should be between 18.6 and 24.9. Excess body fat increases your risk for a wide range of health problems, including high blood pressure, heart disease, type 2 diabetes, and sleep apnea. A BMI over 30 is especially dangerous to your overall health. When it comes to waist circumference, it should be less than 35 inches for women and less than 40 for men. When it comes to blood pressure, that should be less than 120 over 80 milligrams of mercury. When you're doing a fasting blood glucose, your healthy target is up to 100 milligrams per deciliter. Once you start to get levels of 101 to 125, that's kind of indicating pre-diabetes. And if anything goes over 125, that falls into the diabetic range. So you should know your health numbers. Through home monitoring and regular visits with your healthcare provider, you can keep track of your blood sugar, blood pressure, blood cholesterol, and weight. These critical health numbers provide insight into how well your treatment plan is working to manage your diabetes, if you have it, and also to safeguard your overall health, including that of your heart. So, what can we do to keep our heart healthy? If you smoke, get some help to quit. According to the American Heart Association and the US Surgeon General, this is how your body starts to recover when you quit smoking. In the first 20 minutes, your blood pressure and heart rate recover from the nicotine-induced spikes. After about 12 hours, the carbon monoxide levels start to return to normal. After about 2 weeks, your circulation and lung function begin to improve. Anywhere from 1 to 9 months, you have clearer and deeper breathing. You're coughing less shortness of breath. After 1 year, your risk of coronary heart disease is reduced by 50%. After 5 years, your risk of cancer of the mouth, throat, esophagus, and bladder are cut in half. Also, same with your risk of cervical cancer and stroke. Those return to normal. After 10 years, you're half as likely to die from lung cancer, and your risk of larynx and pancreatic cancer decreases. And after 15 years, your risk of coronary heart disease is the same as a non-smoker. Healthy diet is one of the best weapons for fighting cardiovascular disease. Eat from the rainbow. Make colorful food choices with fruits and vegetables. Go for the whole grain products. And with dairy products, go for low or non-fat options. Vary your protein choices. Choose lean cuts of meat. Include fish and plant-based proteins, such as beans, seeds, nuts, and soy. Eggs are a great source of protein, and they do not raise the blood cholesterol. Of course, you want to stay away from items that are high in cholesterol, saturated fat, trans fat, or loaded with sugar and salt. A healthy diet can include fresh, frozen, canned, and dried produce. Just watch the portion size on items like dehydrated fruit. The sugars in those are concentrated. Select canned and frozen fruit and vegetables without salty sauces or sugary syrups. Drain and rinse canned products to get rid of some of the additives like salt and sugar. I'm all about quick, easy meal planning. These are great ways to eat more veggies. The top row is grilled chicken skewers with veggies, grilled fish tacos, cauliflower fried rice. The bottom row is baked salmon with veggies all in one sheet pan, grilled eggplant Parmesan pizza, slow cooker curried butternut squash stew. Quick ways to add more veggies to your meals: blend them in smoothies, add them to your favorite pasta sauce, saute or grill them. Add more veggies to a salad and toss them in soups. Physical activity is anything that moves your body and burns calories. This includes things like walking, climbing stairs, and stretching. When done at a moderate intensity, your heart's going to beat faster and you'll breathe harder than normal, but you should still be able to talk. Think of it as medium or moderate amount of effort. Now, vigorous intensity activities will push your body a little harder. They will require a higher amount of effort. You won't be able to talk much without getting out of breath. For maximum benefits, include both moderate and vigorous intensity activity in your routine, along with strengthening and stretching exercises. Find ways to get outside, even for 10 minutes. Have an exercise plan if the weather is bad. Use stairs at home or work. Use an exercise band or a ball. Lots of different apps guide you through some daily exercises. Explore the outdoors. Get out to the parks. Enjoy the changing colors of the seasons. Now, many people have difficulty losing weight. For those above a healthy weight, a sustained weight loss of 3 to 5% of your body weight may lead to significant reductions in some risk factors. Greater sustained weight losses can improve blood pressure, cholesterol, and blood glucose. So what's the secret? We'll take it from people who have successfully maintained their weight loss. They have modified their eating habits. They've also increased their physical activity, especially walking. Learn your body mass index. Set yourself up for success with short-term goals like I'll walk for 20 minutes 3 times a week. Short-term goals can seem more achievable and keep you on track toward your long-term goals. Use a food diary or a tracking app to understand what, how much, and when you're eating. Be mindful of your eating habits and be aware of your roadblocks and excuses that can help you get real about your goals. It's easy to overeat when we're served too much food. Smaller portions can help prevent eating too much. So learn the difference between a portion and a serving and how to keep portions reasonable. And you don't have to give up your favorite foods. Learn to make smart food choices and simple substitutions instead. Discover healthy snacks and how eating fruits, vegetables, and whole grains keep you fuller longer. And aim for 150 minutes of moderate activity a week. Move more with more intensity and sit less. If you have a family history or other risk factors for diabetes, or if you have been diagnosed with prediabetes, managing your weight through proper nutrition and regular physical activity, quitting smoking, and finding healthy ways to deal with stress, you can prevent or delay the onset of diabetes or minimize its impact on your body. Get support to quit smoking. In many instances, lifestyle changes must be accompanied by medication to control blood glucose levels, high blood pressure, and cholesterol. A key part of managing type 2 diabetes is maintaining a healthy diet. You need to eat something sustainable that helps you feel better and still makes you feel happy and fed. Remember, it's a process. Work to find helpful tips and diet plans that best suit your lifestyle. Fitness is another key to managing type 2. And the good news, all you have to do is get moving. The key is to find activities you love and do them as often as you can. If your doctor has prescribed medication, take it as directed. Talk with your doctor about any side effects and do not stop taking your medication until you consult with your doctor. Work with your doctor and see your doctor for regular checkups. As discussed earlier, a sufficient amount of deep sleep is thought to be very important to the regulation of glucose in the body. Another great reason to get those Z's. Try these tips to get out of stress fast. Take a few slow, deep breaths until you feel your body unclench a bit. Go for a walk, even if it's just to the restroom and back. That can help break the tension and give you a chance to think things through. Try a quick meditation or prayer to get some perspective. If it's not urgent, sleep on it and respond tomorrow. Walk away from the situation for a while and handle it later once things have calmed down. Chill out with music or an inspirational podcast. Take a break to pet a dog, hug a loved one, or help somebody out. Work out or do something active. Exercise is one of the best antidotes for stress. Spend at least 15 minutes every day finding pleasure in something that you enjoy. Identify sources of stress in your life and look for ways to reduce and manage them. A healthcare professional can help you find ways to manage your stress. What should you do if you have problems sleeping? Well, you should be going to bed and waking up at the same time every day, including the weekends. Sleep in a dark, quiet place set at a comfortable temperature. Avoid caffeine, alcohol, and large meals right before hitting the pillow. Exercise. Physical activity during the day makes it easier to fall asleep. Night but you may not want to exercise right before bed. Talk with your doctor or your healthcare professional if you have symptoms of a sleep disorder or you've tried these self-help measures and still can't get to sleep. Download a sleep app on your smartphone. A plethora of smartphone apps are designed to help us fall and stay asleep. Many of these apps offer free, soothing music or relaxation exercises, such as guided imagery, that can help your busy brain quiet down. If environmental noise or your partner's snoring keeps you awake, consider using a white noise machine. Now, these next slides are on programs that help HealthNet members stay on track with their health. Our members can find our wellness programs and other resources when logging into the HealthNet account. Our health risk assessment is called the Real Age Assessment. Be sure to take it and check out our other Wellness Center programs. Telephonic support provides help right at your fingertips. Tackling new health goals can be challenging, but you don't have to face it alone. Maybe this is the year you explore health coaching. Coaches can help you prioritize your goals, strategize a plan, support you through your journey, and help you tackle those bumps on the road. If you have a health concern, HealthNet members can call the Nurse Advice Line to speak to a registered nurse. myStrength has proven tools for your mind, body, and spirit. This online program is also available in an app form to access through your smartphone so you can have support at home and on the go. To help you learn to reduce stress, anxiety, depression, or substance abuse, it has modules, quick videos from mental health professionals, guided meditations, and inspirations on the topics of joy, laughter, positivity, meditation, mindfulness, relaxation, COVID-19, and racism, just to name a few. It's free for HealthNet members. Save money and take advantage of our member discounts. HealthNet members can receive discounts on Weight Watchers, chiropractic and acupuncture services, eye care, hearing aids, even our fitness club discount. Now, if you're not a HealthNet member, please check with your health plan to see if they offer similar programs, services, and discounts. Last but not least, mark your calendar to join us for our next wellness webinar next month. Now, this webinar will be brought to you by our partner, John Muir Health. Our guest presenter is a physical therapist who will cover common back injuries and prevention. He'll discuss the negative effects of prolonged sitting, proper footwear, back stretches and strengthening exercises, good posture, the anatomy of the back and how it relates to safe and unsafe movement patterns, causes of back pain and how to decipher different types of back pain, and simple yet effective stretches to promote flexibility. We hope you will join us next month. Thank you for your time today. If you have not already done so and you're joined a conference room, please chat the number of attendees to Kristen. Thank you so much for your time today, and you will feel free to exit the webinar at this time.